Good morning, everyone. February 15th is considered International Childhood Cancer Day. Every year, all the pediatric oncologists across the world they come together. They use this opportunity to create awareness about childhood cancers. Just one second. The current year's theme is challenge to change. So this year we have intensified our awareness campaigns overall across the world. So many people, doctors and scientists and social workers, community health workers, everybody is working towards increasing the cancer awareness among childhood about childhood cancers among the parents. So next slide, please. Yeah. This is the WHO estimate. Around 3 lakh children are diagnosed with cancer each year across the world. The most common cancer being leukemia, the second most common cancer being brain tumor, that's called CNS tumors. So leukemia and brain tumors, these are the two common cancers in the pediatric population that's below 18 years of age. Next slide. We have cancer population-based cancer registries in the country. So there are around 15 hospital-based cancer registries also functioning in the country. So the estimate says that up to 75,000 patients, pediatric patients below 19 years of age, are diagnosed with cancer in the country. Next slide. Childhood cancer treatment facilities are predominantly or mainly available in metropolitan cities and only few state capitals. There are very few trained pediatric oncologists. Of course, the infrastructure required to treat a childhood cancer is very limited. That's why there is a lot of challenges to treat a child with cancer. Next slide. So if you see, it's one of the very beautiful curves. If you see the cure, this is the cure rates of various pediatric cancers. The each colorful line represents one cancer in child, which happens in children. So if you see the cure rates in 1950s, most of the childhood cancers, their survival was below 20%. So in the current era, beyond 2000, most of the childhood cancers, more than 80% of the children are getting cured permanently. So such dramatic advances has happened from below 20% of cure rate or survival to more than 80% survival. That is possible only because of a lot of advancement in the science and technology related to the pediatric cancers. Lot and more doctors and nurses and nutritionists and physiotherapists and surgeons, radiation oncologists, all these people are getting trained in pediatric cancers. So more and more people are available, and of course, a lot of philanthropic support through NGOs is also flowing in for treatment of childhood cancers. So many changes has happened in the last 5 decades. Next slide. But this rosy picture is only in the Western world. If you see the WHO estimates, there is a lot of inequity across the countries. In the high-income countries, for example, in Europe and Northern America, more than 80% of the children survive when they're diagnosed with cancer. But in India and other low and middle-income countries, the survival is predicted to be between 20 to 30%. This is because the many of these patients they won't get diagnosed with cancer at all, and when they get diagnosed with cancer, there many a times it will be very late. So we need to one of the biggest challenges in treating childhood cancer is that we need to pick the cancer at an early stage so that we can treat them efficiently and to cure most of them. Next slide. There's a question that in adults we do a lot of things. For example, in breast cancer they do mammography. In for cervical cancer they do Pap smear. So can we do something like that in children? So to understand that, we need to understand why cancer happen in adults and why cancer happen in children. So in adults, one of the most important factor for developing cancer is old age. It's related to the age. So the older a patient, older the age of an individual, the likelihood of cancer increases. So similarly, second important thing is lifestyle. For example, smoking tobacco or chewing tobacco, consuming alcohol. Then there are some infections, for example, HPV, human papillomaviral infection, EBV infections. Many of these infections will lead to cancers in adults, obesity. So the most of these risk factors, except for the old age, these are preventable, and you can also screen. For example, if you screen only the patients who are smoking, the likelihood of you picking a lung cancer is quite high. So we know why there is a why cancer happen in some particular individuals. So if you screen those at-risk individuals, you can diagnose at an early stage. This can happen in adults, but in children there are no known risk factors as such. More than 96% of the pediatric patients they are diagnosed with cancer without they don't have any risk factors. Only a selected minuscule patient number of patients they will have some genetic reason or heritable cancer reason as a risk factor. So because most of these cancers are, we don't know the risk factors, so we can't prevent it and we can't screen it. So that's why most of the pediatric tumors, they will diagnose only at many times with a advanced stage, because we can't screen it, we can't prevent it, we can't diagnose it early. Next slide, please. So to understand, so if we know that we can't screen it, we can't prevent it. So only what we can do is we can diagnose it at an early stage. So we have to understand what are those early symptoms. So pediatric cancers, their presentation many a times it will mimic infections in most of the times. For example, fever for more than 7 days. For a child to have fever, there could be various reasons, which includes simple malaria, viral infections, dengue, so tuberculosis, typhoid. So these are the common causes where the child will develop fever. But when the usually most of this fever will go away within 3 to 5 days. But when the fever persists for more than 7 days, it is an important factor which we need to understand. Probably we need to be very careful about it and probably consult a doctor. Next slide. So when other symptoms which includes bleeding, you can see a child with bleeding into the joint in the left slide here. In the right slide, you can see a child with skin bleeding into the skin like this. So these could be the early presenting features. Next slide. Next slide. Yeah. So one more important feature is headache in children is very uncommon. If the patient presents with headache and especially associated with vomiting in the morning. So if the patient is vomiting, or if the patient is not waking up in the right time, if the child is not able to perform the daily activities, then we need to be really careful. We need to consult a pediatrician to see what is going wrong in the child. So there are some simple reasons. For example, a simple refractory error, also called power to the eye, can lead to some headache. But that will usually be more in the evening hours. But early morning headache associated with vomiting is one of the important risk factors, which should be early signs. So we should really consider to meet a pediatrician. Next slide. There are some rarer presentations like this, swelling or abdominal distension like this. Next slide. So presentation of swelling in the neck, either in one side or more, both the sides. Next slide. You can see in this patient, the patient has swelling on both the sides of the neck. Next slide. So sometimes bone and joint swelling. You can see one joint is normal, the other joint is swollen. So such enlargement of the joints or swollen joints, along with the presentation with the severe pain. So this could be any reason or early symptom of a bone tumor. So we need to be careful about this. So one of the important slide of this presentation, today's presentation, you can see in this both the kids' eyes, the right eye, the right side of the picture, you can see the normal eye, where when you shine light to the eyes, or if you take a picture or a photograph of a eye of a child, it should normally visible like a pink or a grayish hue from the eye. But you can see on both these pictures, on the right side there is white reflex. So white reflex is one of the important early symptom or early sign of a childhood cancer called retinoblastoma. So children with retinoblastoma, if they're diagnosed at a very early stage of like this, they can be treated with sometimes without chemotherapy, and many of these patients are cured without chemotherapy, and sometimes only with laser therapy, or sometimes only with the cryotherapy and without surgery also. Next slide. Yeah, this is the same picture. One more picture. The child's one eye is normal, another eye is abnormal. You can see the whitish reflex or whitish hue from within the eye. Next slide. So there are some other kids who presents like this bulging of the one eye or a two eyes like this. Next slide. So other swelling is abdominal distension like this, or a bony swelling which can present like this. Next slide. Sometimes at birth, some of these kids are present with the mass near the buttocks like this. Next slide. Again, bony swelling, which was discussed. One joint is normal, another joint is abnormal. You can see here. Next slide. Next slide. So these are the various early warning signs. So if you find any of these early signs or symptoms, and if you discuss with your pediatrician, talk to them, tell them about your concerns, many of these times the pediatricians will order some investigations, and they will be able to diagnose or refer to a pediatric oncologist for the diagnosis and treatment part of it. So once we are diagnosed with cancer, how are the childhood cancers treated? So childhood cancers are treated with mainly two to three different modalities. The first one is called chemotherapy. Chemotherapy, these are the medications which are used to kill the cancer cells. They're usually used in cycles. These are very effective. Sometimes these many of these chemotherapy, they are associated with some symptoms or some side effects like vomiting, hair fall. But most of these symptoms are temporary. Many of these can be managed on a outpatient basis. So most of these children, when they undergo treatment for cancer, they receive treatment on outpatient basis. Next slide. The second important thing is surgery. So whenever there are tumors associated in the body organs, so especially if they are localized to one or two particular organs, we can remove the tumor from the body. And many of the times there are some tumors, for example, early stage neuroblastomas. There are some other tumors like infantile fibrosarcoma. Many of these tumors can be cured with only a simple surgery. So surgery is one of the important modalities in the treatment of pediatric cancers. So this is very important. Next slide. Radiotherapy, this is a technique where high energy radiation beam is delivered to the organ of the tumor infiltration. So whenever the tumor is there in particular organs, we can treat the tumor in wherever there is the tumor is by giving high energy radiation beam. And many of these patients can be treated with only radiation alone. So, but radiation is commonly used after surgery in pediatric tumors, especially very important in bone tumors and brain tumors. Very, very important. Next slide. So how is it different to treat a child with cancer? Is it same like treating an adult cancer? So no, it is very, very different. For example, in adults, many of these patients that when they diagnosed with cancer, previous slide, please. So when the adults are diagnosed with pediatric cancers, many a times what will happen is they will need to undergo chemotherapy, surgery, radiation. But many of these patients, the cure rates are very, very less. So that's why many people, when they hear the word of cancer, they have the apprehension or fear that, oh, this is a death sentence. No, it is not like that. In children, if they are diagnosed correctly and if they're treated adequately, most of the children with diagnosed with cancer will be cured. So unlike in adults where the cure rates are only 20 to 30% or 30%, so in children, many of the childhood cancers are cured for life because many of the cancers in adults, which happens for a particular reason, and the type of tumors we see in adults is also very different. But in children, the type of cancers we see is different. And the way they respond to treatment is very, very different. In children, a simple chemotherapy or radiation sometimes will be curative. In adults, many times we have to use surgery, chemotherapy, radiation all together, and still the cure rates are low. So pediatrics is very, very different. So we need to childhood cancers needs to be addressed in a specialized units where there is a dedicated team of people who are working with childhood cancers. Next slide. So what are the challenges we face is that child will usually cry whenever they have any issues. If the child is sleepy, if the child is hungry, if the child is scared of somebody, if the child is diaper is wet. So for all the complaints, the child will cry. So it is very, very difficult for an oncologist, sometimes even to the parents, to understand why a child is crying. So that requires a special efforts and special understanding and experience to understand why a child is crying. Next slide. So, and children are non-cooperative. When they come to the hospital, they usually stay far away from the doctors, and even they feel that even a simple needle, they will always try to resist and try to run away from the doctors. So, it's quite challenging to manage a child when we are treating the child. Next slide. So, and children will have poor body reserve. What do you mean by that? A child may be happy in the morning, and by evening, even a simple fever or simple vomiting or loose stools can make the child sick, and child can sleep for some time. So these are some. So there is very, very difficult to. So the most of these children, when they're undergoing treatment, even for a simple just like cough and cold, they will get admitted in the hospital because they look sick. Next slide. So these are the challenges in treating a children. Of course, for parents, there are other challenges because if the child, for example, a child in Gulbarga is diagnosed with cancer, the parents has to relocate because many of the treatment for childhood cancer is available or it's concentrated in the metro cities. Many of times they may have to come to Bangalore for receiving the complete spectrum of treatment, which includes chemotherapy, surgery, and radiation. So it will be very, very challenging for the families also. Of course, there's the big challenge of the financial burden, where to stay, what to eat, so how to cope up with. So also there is an issue of loss of their daily wages or the job perspective into it. So there are many challenges in treating a childhood cancer. Next slide. And also there is special care is needed for treating childhood cancer. You can see this is one of the pediatric wards where we have kept it very colorful. Also, there is a television so that when the child is bored or when the child is sleeping or when the child is awake, the child can watch the television. Of course, we have looked into it that most of these childhood wards they are well ventilated, and also there are only two patients in per room. Next slide. So infection control, very, very important part of the pediatric cancers. We need to take care of the hand hygiene to control the spread of infections from one patient to other patient. Next slide. Of course, many of these times for administration of chemotherapy, uh, hydration, saline, so blood products, antibiotics when they develop fever. All these things will require repeated sampling of the blood as well as administration of medications through a central line. So it is very difficult to prick a child for every time when they require to administer anything. So normally what we do is we use something called chemopod, which is there in the left side of the picture. On the right side, it's a triple lumen catheter. So we'll use either of these things so that the child will have a treatment, receive the treatment without any major pain. Next slide. Of course, many of the children, when they receive chemotherapy or when they undergo treatment for cancer, they will not be able to eat. So many of these patients will require nutritional support in the either form of partial parental nutrition or a total parental nutrition, sometimes so that the child's nutrition is well maintained. So that if the weight of the patient is well maintained during the therapy, then the child will tolerate the chemotherapy better, and so the child will get cured faster. Next slide. Of course, a lot of things is needed about the social support, financial support. So in our hospital, we have a dedicated team, that's Ramaji. She handles and deals with all the non-government organizations and of course the various schemes. So she personally consults the families about the facilities available at the institute, and that's Simaji. She also helps the families to get the financial benefit. Of course, there are many schemes. For example, a patient who finished the treatment, the patient will also receive scholarship once the child go joins back to school for the treatment. All the things are taken care by our charity department team. Next slide. So next slide. Yeah. So that's Sri Shankara Cancer Hospital. We have state of the art infrastructure to treat child with cancer. Next slide. We can see that's a blood bank and its components. These are the components which we use routinely to separate the blood components. Once a patient donates, once a donor donates the blood, we need to separate the components and use it. A simple unit of blood can be separated into 2 to 3 different components, can be given into 2 to 3 different patients, so that we can utilize the all part of the blood which is donated. Next slide. So it requires a dedicated ICU to treat many of these patients with cancer. Next slide. So of course, hematology lab is very, very important because more than half of the pediatric cancers, they are blood cancers and related cancers. So hematology lab is very, very important. That's our head of the department of hematology, Dr. Jayashree. Next slide. And also a research lab, that's Dr. Aruna. She deals with the genetic testing of many of these patients with cancer. So she will give us the exact type of cancer so we can personalize or individualize the therapy, which is evolving in the pediatric cancers. Next slide. So many of these patients, as I discussed, there are some challenges. For example, patients who comes from Gulbarga or northern part of the Karnataka, or many times when they come to Bangalore for the treatment from other states like Andhra or Tamil Nadu. So they have to stay in the Bangalore for treatment because many of the childhood cancer treatment may go on for months to sometimes up to a year. So in such a long duration treatment, they have to stay in Bangalore. So Shankara Hospital, we have a dedicated long stay center. So where it's a big building where each patient will receive a hotel room, so they will stay in the hotel room, and you can see the parents. It's like a community kitchen. So one mother will be preparing the vegetables. One mother is cutting the vegetables. Another mother is trying to prepare rice. So they will work together as a team, and they cook so that the child can be fed. You can see the in the backdrop. You can also see the cooking units there. Next slide. So when the mothers are cooking, you can see the children. Next slide. Next slide. Yeah. So this slide, you can see that when the mothers are cooking, you can see there are some kids who are undergoing schooling when they are on. So when the mother is cooking, when there's nobody at room, so the children will go to the school. There are professional teachers who will teach the children about, because many of the children, they are missing their school and the friends. So by making them available to attend the school, will make them in touch with the classes as well, the topics as well. So once they go back to the school next year, they will be more well versed with the topics which they have missed during the treatment part. Next slide. So that's our bone marrow transplantation team. So some of these patients may require bone marrow transplantation team, especially when the chemotherapy fails in such patients. Next slide. So there are other things which are needed. That's our social workers and psychologists and team. We can see there's like a group activities of counseling, family counseling about how to take care of the children, what to eat, what not to eat, how to take care of the child, what to wear, and how to prevent infections in many of these children, and how to cope with the stress and other turbulent issues which can happen because of the diagnosis of cancer in the family. Next slide. So also we have, for the caregivers, for the parents and the grandparents of the children who are undergoing treatment in our hospital, we have a dedicated yoga sessions happening once in 15 days, so that their physical and mental health is also well maintained when they are providing care to the children undergoing cancer treatment. Next slide. So I would like to end my talk with these few points. One is child. One of the important challenges in treating a childhood cancer is early diagnosis. So if you have any of the symptoms which we discussed today, if those symptoms are taken care of or addressed well with a good pediatrician, I think that will be important step, early step towards the diagnosis of childhood cancer. If you have any warning signs, please refer to the doctor immediately. And other things which I want to tell you is that second thing, cancer is not a stigma anymore. If you have cancer, don't need to worry. You please talk to the physician. There are various counselors and support available. So talk to the doctor, take help, and face it with confidence rather than worried and being scared about the cancer. For the parents of childhood cancers who are logged in today, I would like to tell you that there are a lot of schemes and services available at Shankara Hospital and, of course, at many hospitals across the country. So please utilize all those schemes so that your burden on the treatment of childhood cancer will come down, so that your child can get well with the support. So next slide. So I would like to end my talk with last few slides. One is February 15th is considered International Childhood Cancer Day, where all the personnel who are involved in treating childhood cancers, they will discuss and they will try to do awareness about childhood cancers in this entire month of February. Next slide. So thank you for all the people for patient listening, and I would be happy to take care of any questions. But I would like to thank and give my acknowledgement to some of the important people who are associated with treating childhood cancers. Next slide, please. Yeah, one of the important thing is Mitra Cancer Foundation. They are providing financial support and psychological support, scholarship, and many other things, counseling for many of these families who are undergoing cancer treatment, both pediatric as well as adult. Next slide. So, Indian Cancer Society, a big organization providing cancer treatment and support, financial support for many patients undergoing treatment. Next slide. Can Kids mainly focused on childhood cancer treatment, so they provide psychological support as well. Next slide. So, Lions Foundation. Next slide. So, Leukemia Crusaders, they are helping us to financial treatment for the treatment of leukemia patients. Next slide. Of course, Yuvraj Singh Foundation is there. They are also providing treatment, financial support as well as education scholarship. Next slide. Rotary Foundation and Lions Foundation, they have provided financial support. They have provided a lot of equipments for our pediatric play area and also infrastructure in our pediatric department. Next slide. Ecom Foundation, of course, they are providing treatment for surgeries for children undergoing cancer treatment. So very helpful. There's many other NGOs called Sahayog Foundation. They are supporting with the finances. Next slide. Make a Week Foundation is providing granting wish for many of these children undergoing treatment. Next slide. Next. So yeah, Samiksha Foundation. This is one NGO which is mainly focused on providing education to the children undergoing treatment. So this is providing education for both during at the hospital as well as the hostel. Next slide. So Cuddles Foundation is mainly dealing with the nutrition part of it. So Cuddles Nutrition, they have provided nutritionists and nutrition support. So many of these patients who come from rural background or poor background, they will get free food as well as the nutrition supplements during the treatment, so that the child can maintain the nutrition and tolerate the therapy well. Next slide. Tiara Kids, again providing treatment towards a cancer, Chennai-based NGO. Next slide. Yeah, so there are some NGOs like Jivan Dayani which are providing treatment for bone marrow transplantation. So next, please. So all these NGOs are associated with our Sri Shankara Cancer Foundation at Sri Shankara Cancer Hospital, Bengaluru, so that we can provide treatment for many of these children free of charge. So I am proud to say that with the support of various these NGOs under Shankara Hospital, we have been treating more than two-thirds of the patients free of charge at our hospital, also providing them free stay, food, and travel to the hospital so that their treatment is very smooth. And once that treatment is done, they can go back to their home without having a large burden of loan or financial burden. So I would like to end my talk with this. So I'll be happy to take if there are any questions in the chat box, or I can take direct questions as well. Thank you.
What would you suggest the young parents or upcoming couples who are going to be parents?
So, in the talk, I discussed briefly about the reasons why a child would develop cancer. So, there are no known or a preventable reason to for diagnosis of cancer in a child. So that means we don't know why children develop cancer. So that also means that we can't prevent most of the childhood cancers. So a couple can't even. I don't think we can try to prevent or make any steps so that we can avoid cancer in a child. That doesn't mean that all children will develop cancer. No, no, no. I didn't mean that way. Because cancer in children is very, very rare. So out of a lakh children, only 3 to 5 would develop cancer in a year. So it's very, very small compared to adult cancers. So that means that it's very rare, but we can only do early diagnosis when the child develop any of the symptoms which I discussed. I would be more than happy to share a slide of the early warning signs so that everybody can have a handout kind of thing, and they can keep it or share it with the volunteers, so that if the child, any of the child have such early symptoms, they need to visit a doctor.
Couple of questions, doctor. So, what is the common cancers in children?
Yeah, so I briefly touched upon it. Leukemias and brain tumors, these are the common tumors, but cancer can happen in any part of the body, starting from the brain, eye, bones, muscles, virtually every organ, liver, kidney, spleen. So any organ in the human body can be affected with the cancer. Similarly, in children also they can affect with any body organs. But the common ones are the uh, blood cancers and brain tumors.
After treatment, can a child lead a normal life?
Yes, yes. So when I was discussing about the cure rate, many of the childhood cancers, if they're treated adequately and if they're diagnosed at early stage and treated adequately, their cure rates are quite high. And once they are cured, they can lead a normal life. They can go to the school, they can grow well, and they can have a healthy, happy life. Or they can study and they can get married and have kids also. So this is true and possible in many or most of the children who have finished the treatment in childhood cancers.
What is bone marrow transplantation? Is it commonly used in childhood cancers?
Yeah. So there are some conditions like, for example, leukemias, and there are some conditions like lymphomas and high-risk neuroblastomas. These are the conditions when the treatment will not be sufficient with only chemotherapy. So we use a special technique called bone marrow transplantation, where we use high-dose chemotherapy to kill the tumor cells which have not been killed with regular chemotherapy, and we will sometimes have to give stem cells from either the own person, which is called autologous bone marrow transplantation, or give stem cells from the donor, which is called allogenic stem cell transplantation. So basically, patient will receive high dose chemotherapy and stem cells so that the cancer can be cured. So the common indications where we do bone marrow transplantation in children with cancer is when the leukemia has come back or when leukemia has failed the chemotherapy. Some of the lymphomas when they have come back after chemotherapy, or in high risk neuroblastoma. These are the common conditions where we use bone marrow transplantation in children with cancer. Yeah. So very commonly used in adults. In children, the role of immunotherapy and targeted therapy it is getting checked now. It's being they explored and described. So we may need some more time for us to use the immunotherapy and targeted therapy very well in children. To briefly explain, immunotherapy is a situation when we use the body's own immunity to boost the immunity cells, so that our body's own immunity cells can go and attack the cancer cells. Basically, we're using our own immunity to kill the cancer cells. So that's the immunotherapy. And targeted therapies, these are the conditions, or these are the medications where we try to kill the cancer cells only particularly. It's in contrast to the chemotherapy, where when we give chemotherapy, it kills cancer cells, and also it can damage the other body organs. That's the reason many of the side effects of chemotherapy can happen. For example, hair fall, oral ulcers, vomiting, all these things happen because of the side effect of cancer therapy. So targeted therapy, it bypasses all those things. It will selectively kill the cancer cells. So many of the side effects of the chemotherapy are not present with the targeted therapy which are available.
What are the challenges faced by the family to get treatment for children cancer, and what are the solutions available?
Yeah. So a few of the challenges which I've discussed is that mainly the diagnosis in time. That is one of the important challenges. So when they face any of the symptoms which is described in the previous talk, what we can do is any of those symptoms, they should visit a pediatrician, take the help of them, and if the doctor says that there is any suspicion of cancer, they have to visit the places, hospitals like Sri Shankara Cancer Hospital, where all the facilities for childhood cancer is available. Apart from it, there are many other challenges. For example, where should they stay when they come to Bangalore? How long they should stay? They have to look after their job loss, or the loss of pay which they are facing because of the long duration of the treatment. And visitation, regular travel to the hospital. All these are the various challenges which the family is facing. Of course, there are a lot of conditions, or a lot of support is available. Hospitals like Sri Shankara Cancer Hospital is providing free stay to the many of these families, so they can stay in the hostel without paying anything, so that they can have a free stay. So also we provide ration and particulars, so that they can cook their own food. It's like home away from their home. So it's like staying in their home away from their native place. So they can cook their own food, they stay there, and they visit the hospital whenever they have treatment. So all these facilities are available. So of course, towards the treatment of the cancer, many schemes are available, and many NGOs like Mitra is available now. We're providing treatment towards so financial support towards the treatment of childhood cancers. So all these things are available. Only thing is the parents should be brave. They should uh, take the help and support from the hospital whenever it's available. Thank you.
Just can you touch upon the actual effects of the treatment?
Yeah, you rightly touched upon the topic. Many of the treatment, childhood cancer treatment, it includes some medications which can affect the hormonal system for the children. So, for example, a child with leukemia would receive steroids, and that can lead to obesity and hormonal changes. So, the patient, when the child is finished of the treatment, many a times the child will be obese, and there will be a lot of hormonal abnormalities in the children. Similarly, brain tumor children, when they receive radiotherapy to the brain, some of the radiation will spill over to the pituitary, where which is one of the important organs which produces many hormones. So the patients who received radiation to the brain tumor, their growth may be hampered. The child may not grow adequate height, and some of the hormones like thyroid and things may be deficient in some of these children. So when these things are available, what we know is that at Shankara Cancer Hospital, we have a dedicated OPD for rehabilitating the patients who have finished the treatment. So once they finish the treatment, what we do is normally we make the patient go through some series of questionnaires and tests as well. So we diagnose many of these hormonal changes which are available, and we rehabilitate them. For example, we have currently around 10 children who are finished treatment for brain tumors, and when they are diagnosed, when after treatment they were diagnosed with a short stature, so they were not growing in their height adequately. So what we did is we did some selective tests. So we checked that the growth hormone level in the blood was low, so we started supplementing in them. So this will come to a tune of almost 1 to 1.5 lakhs every year. So almost 10 kids are on growth hormone replacement therapy, and most of these children are growing as on par with their peers in the school. So that means that if adequately diagnosed, many of these side effects which can happen because of the chemo and radiation or surgery of the cancer treatment. So if you diagnose and if you treat adequately, even that can be mitigated. Those effects can be mitigated because there are a lot of facilities available right now. But only thing is the families has to understand that these are available, and they have to reach the right place so that all these things are diagnosed and treated. Similarly, sometimes around in 10-20% of the patients, we may have to take out the limb, especially when they are diagnosed with advanced cancers. So in such patients also, what we use artificial limbs, so that even with the facility of the artificial limb, their vision, the looks will be also normal, and they can even normal like you and me. So that's a kind of rehabilitation. So what has happened in last decades, as I discussed, is that apart from improving the treatment cure rates of childhood cancers, we also trying to use less and less toxic therapy to the children, so that we can avoid some of these late effects which can happen in children. Also, we are rehabilitating. On the second part of it is we are rehabilitating some of the patients who have already had issues with the treatment which they have received, but they are cured of cancer, but they are facing some challenges post treatment. For example, children who have received radiation to the brain, sometimes their overall intellect and IQ can come down a bit by 5 to 10%. Even 5 to 10% reduction in the IQ can then interfere in their performance in their classes like 10th standard or board exams. So what we are doing is, many of the children who are undergoing post treatment of completion, what we do is we give them an intellectual disability certificate, so that they will get extra half an hour time, so that they can utilize that time to memorize whatever they have read and face the exam confidently. These are all officially approved ways of things by Government of India. So we are providing them these certificates, so that they'll get extra time, so that they can face the exam confidently. So all these facilities are available, only provided that they should come to the hospital at the right hospital and right time, so that these things can be counseled them, and provided all these facilities can be provided for the patients who are in need.
There's another question. How come we know that leukemia treatment is failed in children?
So normally what we do is that when we give leukemia treatment, we do something called response assessment by doing a bone marrow examination at the end of 1 month. So when the child with leukemia is diagnosed, the child will receive chemotherapy, and of course during the chemotherapy the child will have to go through blood transfusion, antibiotics if the child develops fever, and the child will have frequent visits to the hospital. Once the treatment of 1 month, one cycle is done, we do a bone marrow assessment, and in the bone marrow assessment we'll get to know that child has responded well to the therapy or not. So that is a important investigation. Sometimes even a blood test also will tell us whether the leukemia has responded.
If the mother has a child at 40, will the child get the cancer?
So pregnancy beyond 35 years of age, it's one of the risk factors for various conditions. For example, you must have heard about a condition called Down syndrome. So Down syndrome, it can happen in patients, in mothers who deliver after 35 to 36 years of age. It will not happen to everybody, but the older the age, the higher likelihood of developing syndromic cancers like this. And some of these syndromes, for example, Down syndrome, there is a high likelihood of developing cancers like blood cancers and other cancers. So it is possible that the older the age of the conception or the pregnancy, the risk of cancer slightly increases.
Okay, thanks, doctor. Once they grow and have their children, can cancer occur again?
So usually no, the answer is no, because many of the patients, once they finish the treatment, they can lead a near normal life as I discussed. So it may not cause any such problems.
Okay, thanks.
Doctor, I had a question. Sorry.
Yeah, go ahead, please.
Doctor, actually, whenever the cancer is detected for the child, so at the initial stage of testing, generally they will ask one question like, was there any person who having, any person in the family having a history of cancer or something? That is a common question like everybody will ask. So obviously, like, once the child is completed the cancer treatment successfully and in future, when they have their own children, like, how do we see that, doctor?
Yeah. So I just discussed about this. So what we know is that uh, 96 to 98% of the childhood cancers, they don't have any reason why it can happen. It just happens during the growth and development of a child. That means that there is no reason why a child would develop cancer, and also it is not heritable. That means that in 96% of the cases when the child is diagnosed with cancer, the child will not pass on that cancer to their offsprings or their siblings. So the cancer will not spread even through their progeny also, or to their siblings. So only around 2 to 4% of the patients will have a family history where the grandparents or uncle and parents would have suffered from some kind of cancer. In such situation, the child could be possibly have inherited a gene which is defective, which is leading to cancer in the child, and that can pass on to their siblings or their progeny. So that means only around 2 to 4% of the children who have developed cancers, they can pass on the cancers to their children. But rest patients, 96 to 98% of the patients will not transmit. So that means majority of the patients will not transmit. Only a minuscule family of where there is a familial cancers, only those patients will transmit. So we need not worry about majority of the patients who are diagnosed with cancer. First of all, cancer in children is quite rare, and out of which it's very, very rare for a child who has developed cancer and got treated will transmit to their offsprings, unless there is a clear family history of cancers. So normally what we do is that once a child is treated for cancer, we closely follow up once they finish the treatment to a duration of up to 3 to 4 years. And once they have passed this phase, we usually call them cured of the cancer, and we follow up them only very frequently, only to say hi, hello, and just check whether they are growing normally and whether doing well in the studies and other things. So the usual duration is up to 3 to 4 years. So within this period, if the child develops any of the symptoms, we usually investigate and we check whether the child has got any recurrence. But as I discussed, most of the 80% of the children, they are cured of the cancers when they are treated. So the recurrences has also significantly come down in the last few decades. So if you treat 100 children, probably only 10 or 20 will develop recurrence, and rest 80 will be cured for life.
Can you please guide us with the genetic test to parents?
So, of course, if any family has got cancers in many more than one person in the family is suffering from cancer, there are various genetic tests available. If they visit the hospital, of course, that's called preventive screening. So we can test for them for the cancer causing genes if they are present in the family, and we can definitely identify it. So these are called hereditary cancer predisposition syndromes. So this is called HCPS. So these gene testing is easily available everywhere, and we can test it with a nominal cost of probably 15-20,000. It's easily available. So these tests are recommended only if there is multiple cancers in the family, more at least two or more than two people in the family has got cancer, then we can test it. Otherwise, unnecessary testing will neither serve any purpose.